marking scheme for the long cases. Each long case is graded on a scale from 1 to 6, where a score of 1 indicates very poor performance, a score of 4 is considered the expected standard and is the pass mark, and a score of 6 represents excellent performance. Your performance is evaluated across several key domains. First, there's the accuracy of history. This domain assesses how thoroughly and accurately you elicit the patient's history, including a clear chronology of events and all relevant details. Next, the accuracy of your clinical examination is reviewed. Examiners look at how well you perform a focused and precise physical exam, following the standard techniques taught in your local training, college resources, and textbooks. Then comes the synthesis and prioritization of clinical problems. This domain examines how effectively you integrate the information from the history and examination to identify and rank the patient's issues based on urgency and impact. In addition, your understanding of the impact of the illness on the patient and their family is taken into account. This includes your ability to articulate the emotional, social, and financial ramifications of the patient's condition. Finally, you are assessed on the development and discussion of an appropriate management plan. Here, you must propose a management plan that is evidence-based, tailored to the patient's needs, and logically derived from your findings. Each of these domains is calibrated against a benchmark set by the examiners. The short cases are graded on the same 1 to 6 scale, but the domains of assessment differ slightly. In a short case, the first domain is your interaction with the patient and, when appropriate, their family. Examiners evaluate your ability to establish rapport, communicate clearly, and ensure that the patient feels comfortable throughout the process. Next is your examination technique, which focuses on how well you perform the physical exam using standard methods, ensuring that your movements are smooth and efficient, and that you keep the patient at ease while avoiding any maneuvers that might cause pain. Accuracy in the physical examination is also critical. You must correctly identify and interpret any abnormal findings. For example, if you are assessing a sign like hepatomegaly, you should clearly describe the liver edge, its size, consistency, tenderness, and quantify the enlargement using established techniques. Additionally, you're expected to interpret and synthesize your physical findings to create a coherent clinical picture. Finally, the domain of investigation and management assesses your ability to discuss potential investigations and management strategies based on your findings. This discussion should be evidence-based and tailored to the patient's clinical context. It's important to note that the final outcome of the exam is determined by aggregating your scores from 2 long cases and 4 short cases. In general, you should aim to achieve at least a score of 4 in each case to pass. Keep in mind that long cases carry more weight than short cases. In some scenarios, you might pass the exam even if one long case falls below expectations, provided your performance in the short cases is strong. For detailed information about the scoring grids, bands, and the aggregation process, please refer to the college website. The key principle is to aim for consistent, satisfactory performance in all cases. By understanding these marking criteria and calibrating your practice sessions to meet or exceed the expected standards, you set yourself up for success on exam day. This comprehensive approach to both long and short cases is essential for demonstrating your clinical competence and ensuring that you deliver patient-centered care in your future practice.